Yes.
Hi, good morning. My name is Layla. I'm going to be your nurse for today. I'm going to be closing your door because I'll be doing a head-to-toe assessment on you. Is that okay?
Yes, that's
All
fine.
right, I'm just going to go ahead and wash my hands. Okay. All right, how are you feeling this morning?
Feeling wonderful. How about yourself?
I'm doing well. Thank you for asking. All right, can you go ahead and tell me your first and last name for me
Richard Munoz,
and your date of birth?
9191.
Mr. Munoz, how would you like me to address you today?
As Richard.
Richard, okay. Richard's medical record number is 0123456. Richard, do you have any allergies to any medications or food or environmental factors?
No, I do not.
No, you don't? Okay. And do you know what today's date is?
Yes, today is April 6, 2018.
Do you know where you are?
Hospital.
All right, fantastic. Richard is alert and oriented ×3. I'm going to go ahead and take a look at your IV site here. He has a 20 gauge in his left AC. No signs of redness, swelling, or infiltration. It is saline locked. There are no fluids ordered. I'm going to go ahead. His skin is warm, dry, and intact. I'm going to check your skin turgor. His skin is elastic and coiling. His capillary refills are less than 3 seconds. His nails are clean, dry, and intact with no drainage. And his right hand is also less than 3 seconds. All right, Richard, we're going to go ahead and start with your head, okay?
Okay.
And then I'll be looking at your ears, your eyes. I'll ask you later to take your glasses off. We'll check your nose and mouth. And then we'll make our way down to listening to your lungs and then your heart. And then all the way down to your toes, okay?
Wonderful.
Stop me if you have any questions whatsoever. Okay, I'm going to be just going to inspect your hair and your scalp for any breakdown. Any pain back here?
Nope.
No pain? Okay, I'm going to just check your ears. No signs of drainage coming from his left ear or his right ear. And then I'm going to go ahead and check the bilateral nose. Bilateral nares are asymmetrical and no present drainage. Go ahead and open your mouth for me and say ah.
Ah.
All right, very good. Mucous membrane is pink and moist. All right, Richard, take your glasses off for me.
Sure.
And we're going to check your eyes. Look straight at me. Good. Richard's eyes are 3 millimeters. They are equal, round, and reactive to light. Go ahead and follow my finger for me. Very good. Perfect. Wonderful. All right, Richard, I'm going to be having you sit up for me. Are you having any difficulty breathing or shortness of breath?
Nope.
Any chest pain?
Nope.
All right, Richard's having a normal rise and fall of his chest. He's not using any accessory muscles. And I'm going to just lower your gown here just for a moment so that we can listen to your lungs.
Okay.
And I'll be using the Greek key pattern. I'll be starting at the apex and going down to his base. Take a deep breath. In through your nose, out through your mouth. Very good. Richard's bilateral lungs are clear in all lung fields. Okay, and now I'm going to be going and listening to your heart. Okay?
Okay.
First, I'm going to be feeling your carotid artery one at a time. Pulses are 2+ on both sides. And I'm just going to open your gown here up, and I'm going to be listening to your heart valves. The aortic valve is going to be the right second intercostal space. The pulmonic is going to be on the left second intercostal space. Erb's point is the third left intercostal space. Tricuspid valve is on the left fourth intercostal space. and the mitral valve, as well as the PMI, is going to be the left fifth intercostal space at the midclavicular line. Okay, for the purpose of this video, we will just be listening to the aortic, pulmonic, herbs, and tricuspid. You could breathe normally. You don't have to, just going to be listening to your heart.
Okay.
And to palpate the PMI, like I mentioned, it would be at the fifth left intercostal space at the midclavicular line. There are no visible or palpable lifts or heaves. Okay, Richard, have you been having any nausea, vomiting, or any diarrhea?
No, I have not.
No, you haven't? Okay. Richard's abdomen is small, it's flat, there's no obvious distension. I'm going to be taking a listen. If I don't hear if I auscultate no sound, I will listen to each quadrant for 5 minutes. I'm now going to switch and listen with my bell, and I will listen to the aorta. Okay, very good. Have you been having any issues with urinating?
No, I have not.
No, you haven't.
No.
When was the last time you went to the bathroom?
About an hour ago.
About an hour ago. And when was your last bowel movement?
About an hour ago.
About an hour ago as well. Are you having any pain or burning when urinating? No? Okay. And next, we're going to be monitoring your intake and output. So anytime you go to the bathroom, please remember to go in the urinal so that we can measure how much you're putting out, and then also how much your intake is as well. Okay?
Okay.
All right. And I'm going to be going ahead and assessing your musculoskeletal, as well as I'm going to just go ahead and palpate your pulses. Your pulses up in your radial is a 2+. Go ahead and squeeze my hands. All right, very good. Bilateral hand grips are strong. You could go ahead and put your glasses on.
Thank you.
Very good. And then we're going to go ahead down to your feet. And I'm going to also check. Are you having any pain or numbness or anything in either hands or your feet?
No.
No. There are no swelling visible on Richard's bilateral feet. I'm going to check his dorsalis pedis, and they are 2+. And I'm also going to check his capillary refill in his toes, and they are also less than 3 seconds. Go ahead and push for me. All right, and lift up. Very good, very good. All right. Before I leave, I wanted to let you know that if you need absolutely anything, you give me a call. This is your call light. You push that red button for me. And we'll be in every hour to round on you, check to see if there's anything that you need. And then before I leave, I know you probably have seen this incentive spirometer. It is, I don't know if anyone's ever explained it to you before, but it's basically to help you prevent developing pneumonia while here in the hospital. Patients who are laying in bed for most of the day and aren't as active as they would if they were outside of the hospital, they have a high risk of developing pneumonia. So it is very, very important to use this. And how you do it is you're going to seal your lips around this point, and you're going to take a big, deep breath in. And you're going to see this little ball rise, and we will mark it as your baseline. And the more you do it, the higher up you go, the better it is because your lungs are re-expanding. Because what happens when you're laying down is all that fluid sits at the base of your lungs and it has nowhere to go when you don't take deep breaths or when you're not moving around. So go ahead and you're going to demonstrate for me. And go ahead and seal your lips around the there you go. And take a deep breath in. Very good. And we're going to go ahead and mark it right there for you. So I'm going to leave this right here by your bedside table. So that way, during every commercial break or in every hour, go ahead and try to use it at least 12 times an hour. Or I tell people during commercial breaks because that way it will remind you, oh, it's time to use this. Okay. So I'm going to keep this close by to you, and I'm going to also hand you your call light so that way you can use both. Okay? Is there anything else that I can assist you with, Richard, while I'm in here?
You've been an angel. Thank you so much.
No problem. At this time, I'll go ahead and bring Richard's bed down, put his arm rails up, make sure he has all necessary things near him and within reach. And I will now go ahead and exit and perform my hand hygiene. All right, Richard, once again, push your call button if you need anything, okay? And we'll be gladly here to assist you.
Beep boop. Okay. Bye. Thank you.
You're welcome.